On the line now is Health Minister Zweli Mhkize to talk about this second confirmed case of the coronavirus in South Africa. Minister, there have been repeated calls for calm, and we must emphasize that a second case was both likely and expected, and that your department has repeatedly expressed its readiness to deal with all cases. Tell us how you're dealing with this second confirmed case.
Yeah, thank you very much. And we are wishing to inform the public that we have confirmed the second person who has tested positive for the coronavirus, and that is a lady who is in Johannesburg. It has been one of the contacts of the first patient that we identified in Johannesburg. They were among the 10 people that had traveled to Italy and came back, and all the others have also been identified and asked to stay on voluntary home isolation. And in the process, we've tested them all, and we're waiting for the results of the others. This one has been confirmed to be positive, and so we're going to be taking her for admission at Charlotte Mhkize in today sometime. And we'll also be sending a team to re-establish now a whole new set of contacts so that we can trace more of the people that have been in close proximity, and then the process of testing contacts will begin amongst those who are in contact with her. But because they were a group of 10, we actually identified them as people who could have been exposed to the infection whilst out in Italy, and therefore all of them are under observation, and we will release the results as they are getting completed. So at the moment, it was just that information to the public. We also want to inform the public that we have been notified by our embassy in South Korea that another South African working out in Daegu in South Korea has tested positive. He's also a 39-year-old male this time, and that one is undergoing tests, and therefore will be informed about what is happening there. That area has also seen an upsurge in the number of infections, and I think at this point, South Korea is close to 7,000 new infections since the outset. So all we're asking the public is that we will manage this particular patient, and we have staff that is ready to deal with all the complications and manage the medical aspect of the condition without them being affected or infected. They are well trained. There is adequate protective clothing. They will then be observing the patient, and we expect that the patient should be able to recover. On the other hand, we're asking the public to just take the basic precautions of hygiene, washing of hands using soap and water. I read that people are talking about sanitizers that are finished in chemistry. It's not mandatory to use sanitizers. Just use water and soap, and also have a protection each time someone sneezes or coughs, so that most of the droplets don't go onto the neighboring people. Those are some of the basic precautions. If somebody has got symptoms, approach your doctor or a clinic and indicate your concern, particularly if you've got a history of contact with someone who has already tested positive. Every country will have coronavirus being spotted inside its borders. It was a matter of time in South Africa. Right now, we've got about 96 countries that seem to have contracted coronavirus. So it will be something that must be a new reality in our setting that we're going to keep working on. But when it arises on a major basis like this, we'll be able to deal with them in our hospitals.
Minister Mhkize, just bringing it back to that second confirmed case here in South Africa, the 39-year-old woman, part of a group travelling to Italy, 10 people, part of that initial group. What is the level of risk of exposure to the other people who might have been on that same flight, and what level of contact has the department had with all those people on that flight?
All of those who are part of the group of 10 have been identified, have been counted, and samples have been taken, those who are within South Africa. And we know exactly where they are, and as soon as we find the results, we notify the patient and then ask them to get ready to be admitted in the hospital. So all of those have been contacted, and our team of epidemiologists and environmentalists are out there talking to them and talking to all their contacts. So we don't have a big problem tracing people. Everyone is cooperating, and so we believe that this situation is still within our control.
Minister, just going back to that question, the other people who were on that flight who were not part of that group of 10, have they been contacted?
They will all be contacted on the basis of the proximity of their seats to those who have been identified. So those who are very close to the one patient that has been concerned will be notified, and therefore their whereabouts be established, and then we will also talk to them. And we established by the time by the end of the day yesterday, 18 people had actually been identified around the first patient, and work was being done to approach them all. So the same kind of work will come now for the new patient. And what we do here, we create the patient as a center, and then we take a whole first circle of all the contacts that were within proximity for a longer period to the patient, and we will then counsel them, ask them to take voluntary quarantine in their homes, and in the process, we will then go talk to them and look at all the circumstances around them and take the specimen. And then they will have to wait until you come back with the specimen and with the results, and then you can guide them what the next thing that they need to do. Each time someone is found to be positive, we put them at the center and we create a whole new circle of the contacts around them and move on. What we are encouraging public to not to fear is that because we are very precise in the way we check the spread of the infection, they should not panic. So we have situations where people say, well, I know the people I know the children of the people who are affected. Could I be also infected? No, we were not going to be infected. So we need to be able to say the contacts to the patients are the first priority. We give them a guide to stay in quarantine. The contacts of the contacts are not really the main priority. They only become our focus when the main contact is actually found to be positive. So because it's methodical, it goes on rings of closer circles of people who are associated with the patient. Therefore, we will not worry all the people. We will just identify those who are in the flight, and we know where they are. Those in close proximity, we deal with them immediately, and then the others will also then check with them. We call them. And many people who are being called. That's why we've got a 24-hour service in our emergency operation center. We call them, continuously to check their symptoms, if they've got fever, if they've got any particular concerns. All of those things are part of the surveillance that we have to embark upon. That's why it's now an emergency operation center that's running.
Right, thank you very much. We have been speaking to Health Minister Zweli Mhkize, appealing for calm once again and explaining that very precise and disciplined procedure to examine the chain of risk or possible infection, and that related to that second case of coronavirus. Breaking news being announced in South Africa, a 39-year-old woman infected in that same group of 10 who came from Italy.